Right, nice to see you all here. I hope you're having a good conference. This afternoon's session is Improving Mental Health by Identifying and Treating Problem Gamblers. So you have three of us here today who have different roles to play within the treatment of problem gambling in England, Wales and Scotland. My name is Sian Griffiths. I'm the Deputy Chair of GambleAware, amongst other things, a public health professional by background. Anna Hemmings here will take over from me mid-presentation, and she can explain who she is, but she comes from GambCare. And then Matt is representing clinicians and service provision, particularly based around what we call the Leeds model. So we'll be talking to you a little bit today about improving mental health and the treatment pathways that are developing at the current time. Now, I'm sure all of you know somebody who gambles. Am I right? I'm seeing some nodding heads. I'm not sure whether that's why you're in the room or you have an interest or you work with people with problem gambling, but most of us know somebody who gambles. And quite a lot of us know someone who gambles with problems. So we're going to talk a little bit about who gambles, what the health harms are, what the National Gambling Treatment Service is, how it fits into the NHS long-term plan, and, as I say, talk about the Leeds model, which is an innovative approach of partnership working between the NHS and voluntary sector to create care pathways for problem gamblers. So who gambles? You'll see the figures here are quite large. You'll see that 63% of adults gambled in the past year. All the figures you look at look a little bit like this. Over half of all adults have gambled in some shape or form, whether it was by lottery cards, scratch cards, on their phones at night, over football matches, or just on the Grand National, which of course everyone says, oh, just on the Grand National is a sort of is the catch-all for Granny and myself. And so a lot of people gamble. And you'll see here that it's not just particularly one age group, although it is one of the commonest groups of people who gamble are young men who follow football. And there has been a huge growth in the numbers of people who play on their phones during football matches rather than watch the matches. And we have a campaign called Bet Regret, which is addressing those issues. You'll also see that it's actually across the whole of the British Isles. So it's not one particular area, which is why Anna's organisation GambCare is very keen to extend services across the whole country and make sure that there is universal access. But you'll see that it's also an inequalities issue, a health inequalities issue. If you look at the black bars, they're the most deprived deciles, and you'll see that if you ask people if they bet more they can afford, it's the people with the least resources who bet more. If you talk about does it cause financial problems, it's those who can least afford it, and problem gamblers are more common in that quartile as well. The impacts of gambling, this slide comes from the local authorities. The local government association has done some work on gambling, and it's a very good document, so if you want to look at in more detail, but it there shows you what the health harms are. So there are health harms that are actual physical as well as psychological. There are relationship issues, of course, domestic violence, abuse, quite high on that agenda, the stresses of gambling addiction on the family or in relationships. And you'll see the social and financial resources are also affected. And amongst children, the numbers of children gambling is very high and growing.
Sorry, are we going to get slides on this? Because you're moving
Yes.
slides along real quickly.
I am sorry. I promised I have 12 slides, and I promised my co-presenters I have 10 minutes, but these will be made available to you.
Right.
And any more that you want, contact us at GambleAware, because there's lots more. And there are also lots of slides at the Gambling Commission, if you go on their website. So there's lots of graphics on this. What I'm trying to show you, I mean, all you really need to see is there's lots of things there. Mental health issues, physical health issues, family issues, social issues, school issues. And so you'll definitely want this next slide of mine, it's got even more on it. It's about levels of harm. So it's individual, family, workplace, community, society. The headlines are what you need to take away, but if you want to look in more depth at how gambling can impact, how gambling-related harm can impact on our lives, there is a whole literature and a growing literature on this. And as I say, young people, this is the sort of graphic you can find on the Gambling Commission website. It's a growing issue, and those of you with children might wonder about gaming and gambling and that whole interface, and I think we as yet know very little about that, which is why in GambleAware we're working with the PHSE national organisation to try to raise awareness about the need for resilience in gambling. So I just put that in, but you'll see here large numbers of children are gambling, be it through the gaming route or be it through following their parents and seeing it as normative behaviour. I leave that thought with you. Things are happening. This is a slide, it's a slightly old slide from Public Health England, but it's about a campaign that's about to be launched in October. The graphics will look different, but we are actually a partner within, GambleAware is a partner within the PHE campaign, and it's Every Mind Matters campaign toolkit. This is the new mental health initiative that will be coming from Public Health England. The One New campaign within Public Health England has recognised gambling and gambling addiction as a harm, and if you follow the link on the One New slide, you can it then takes you into where to get support and advice. And if you look at the NHS plan, which you're all very much more familiar with than I am, you'll see that you can get help for problem gambling linked into the GambleAware and the GambleAware helpline. And Anna will be able to tell you that the GambleAware helpline will go 24-hour from next Monday. So we will have 24-hour help and assistance as opposed to a helpline that closed down at night. And if you look at the pattern of gambling, that shows that that initiative will be a very important one, we think, for helping people who continue to gamble online, because gambling online is really one of those big issues which we have yet to get to grips with. And we're also working with other bodies such as the Royal Society of Public Health. And the Royal Society of Public Health are working with primary care. They're also working across many broad organisations to try to raise awareness of gambling, the risks of gambling-related harm, and the need for early intervention, and not just for treatment. So I've tried to show that we work in partnership between the voluntary sector, GambleAware, GamCare, other voluntary groups, the NHS and other statutory organisations and other charities such as RSPH. And we do this because gambling is an increasingly recognised health harm. But I know we're here today really to talk about the National Gambling Treatment Service, and this is not my area at all, so I'll be handing over now to Anna to tell you about GamCare. GamCare is our major partner in terms of gambling treatment, but just to give you a little bit of a picture, we think that about 3% of those in need are getting treatment at the present time. 3%. That's not enough. That's not universal coverage, and we all need to think how we can do this better. So what we need to think about is how to do integrated pathways, how to get universal national coverage, how to get the data that we need, and how to help people work together and to alert communities to the harms that they need to address together. So I'm going to hand over to Anna, and she'll take over from here and tell you more about the treatment services that are provided.
Thanks very much, Sian. So my name's Anna Hemmings and I'm the CEO of GamCare. We're the largest provider of treatment and support for problem gamblers nationally. We're a charity. We've been around for about 20 years. And I've been in post since January 18. And I guess what has really been noticeable in that period, the more recent period, is that gambling has been in the media more, there has been more political interest, and that has led to interest across the board in terms of delivering improved treatment and integrated care pathways. So the way that we operate is that we're the lead provider for a network of national treatment and support. We deliver treatment directly in London and surrounding areas and via a network of partners around the country. And we've got, if you look at upper tier local authority areas, we have a presence in 93% of them. But as Sean said, we're looking to increase our capacity and coverage because we want to significantly increase the number of people coming through treatment. So treatment is usually delivered one-to-one, but also in group settings, usually face-to-face, but it might also be on the phone or via Skype or online settings. There is an organisation called Gordon Moody that provide residential rehabilitation for the most severe problem gamblers. And there's also 2 NHS clinics now, one that Matt will be talking about later, who provide support for those for more complex needs. So up until this point, probably GambCare and our network has seen about 95% of the people who come through treatment in the country. But going forward, we're delighted that we've got increased NHS resources and more support to work in an integrated way. Because some of the people that come forward do have complex needs, we look at both severity and complexity. Severity is high across the board when people come into treatment, and for some of those people they have additional complexity factors around things like mental health, safeguarding concerns, debt, money worries. Sometimes that's had a knock-on effect on their housing. So we look at those people in the round, and the model we're working to is that the NHS will work with those with the most complex needs, and that GambCare and our partner network will work with those with more moderate needs. And the advantage of having this lead provider model is that we can deliver those integrated pathways consistently around the country. All our partners are signed up to the same model of care. We're working very closely with the NHS providers to look at this kind of step up, step down model and the care pathways for that. And the other thing we've got is excellent data. We've got a consistent data set nationally that all of us collect and can analyse. And so we've got actually a good idea of the impact that the treatment actually has. What we tend to see in terms of how people present, problem gambling seems to escalate quite quickly for people, but also resolve well with treatment. So at the point people come, they're often at crisis and very distressed, lots of difficulties in their lives. And by increasing the capacity and availability of treatment, what we'd hope is that people come forward earlier, because that's probably the most effective way we can begin to minimise gambling-related harm. When people are in treatment, we use 2 main measures throughout. PGSI is the Problem Gambling Severity Index, so a severity measure. And the average starting score, as you can see here, is 18. Now, you can look up the measure. It's very available online and very internationally recognised as a severity measure. But a score of 18 is very high coming into treatment. And at the end of treatment, people are scoring about 4. So there's a huge improvement in their gambling. We also use Core 10, which some of you might be more familiar with as a quality of life measure. And again, what we see is a significant improvement for people in terms of quality of life. The average number of sessions is fairly short, it's about 6. So for a lot of people, they achieve a really good improvement in a relatively short space of time. And we don't see too many people coming back into treatment repeatedly. So we're reasonably confident that what we do is fairly successful. But what we do need to do is reach more people and earlier in order to be able to, as I say, minimise harm. In terms of how people come forward, GambCare operates the National Gambling Helpline, which is free to call. It operates on the phone and on live chat. The average age of callers is relatively young, actually. Over 60% are under 35, and younger people do prefer to text rather than pick up the phone and talk to somebody. So we're seeing an increase in the live chat. As Sean said, we're going 24-hour from next week. So currently we're 8 a.m. to midnight, but next week it'll be 24 hours a day, which we're absolutely delighted about, because obviously overnight is a time when people sometimes feel the most isolated and distressed. So it's really great that we will be able to offer a service throughout the night to those people. The helpline does more than just offer, a brief bit of advice. We interact with people for quite a long time. The average call length is about 35 minutes, so relatively long. We give people lots of practical advice about things like self-exclusion and software blocking. We also talk through some of the distress or the emotional issues that might be presenting, and we make direct referrals into our treatment network. So they all use the same database, and we can get people out to a local treatment provider close to them very, very quickly. We do callbacks, so some people want a bit more interaction from the helpline, and especially if we're concerned about someone's well-being as well, we'll make arrangements to call them back. We have a cohort of callers, a smaller group, who are very frequent callers and who we have to manage sort of fairly assertively with local mental health services and other services where they live. It's also worth looking at our website because there's forums on there which are a form of peer support, and there's about 40,000 registered users for them. And if any of you want to see what problem gamblers experience, it's a great place to sign up, and you can see people talking about their experiences of treatment. There's lots of recovery diaries on there. And it's an interesting place to be what's not very attractively called a lurker. Or of course you could contribute to those forums as well if you don't want to just lurk. We do chat rooms online, which are facilitated groups twice a day, and our helpline staff facilitate them. And we're also looking at more and more choice, I suppose, in treatment options. So we're launching computerised CBT in the next month or so as an alternative if people would prefer that to face-to-face treatment. And also looking at things like incorporating lived experience and peer support as well into our models. So I suppose we're in a period of rapid development because there is the need out there, and that's becoming increasingly recognised, and we see that as a really positive thing. So I wanted to talk to you a bit about Leeds, which Matt will be talking about as well. The Leeds Pathfinder is a new service that we've opened in Leeds city centre, and it's a partnership between GambleAware, our local partner up there, Necker, and the NHS Trust in Leeds and York. And the way that it works is to work right across the spectrum from engagement and prevention work through to targeted support for particular groups and treatment support for everyone, including those with complex needs. It's had very strong support from the local authority, so we're co-located in a local authority building, and they've been great at engaging with us, but also with other groups in the health and social care economy, if you like, in Leeds. So within the service, we've got outreach workers who are getting out and about, training professionals. So if you've got a problem gambler, for example, going to a debt service, does the debt advisor ask if there's a gambling issue? Or in mental health services, are you asking if gambling's affecting someone's mental health? So delivering training to those professionals just helps raise awareness around the importance of asking that question and exploring gambling as an issue. So training professionals, but also engaging with community groups, sports facilities, young people in education, the universities in Leeds, really getting out there and raising awareness of the fact that we're there, we're delivering service, and there is information for those that want it and support for those that need it, both for problem gamblers and those around them, those affected by problem gambling. For those that do need support, we can provide that directly via GambleAware and Necker, and we're also working very closely with the NHS service so that we can very seamlessly support those who have got more complex needs and might need or might benefit from a clinical intervention. So we're incredibly excited about the service because it's the first of its kind in the sense that it works right across that spectrum from prevention to targeted support, right across treatment needs. It's fairly new. We had a press launch last week, I think, and we've got a formal launch on the 15th of October. But we're all there and we're up and running, and we're hoping that Leeds will provide us with a sort of springboard to replicate that model in other parts of the country. So on that note, I think I'm going to hand you over to Matt from the NHS Trust that we're partnering with in Leeds to talk about their wider Northern Gambling services.
Okay, good afternoon. So my name is Matthew Gaskell. I'm a consultant psychologist. I'm the clinical lead for addiction services across the Leeds and York NHS Trust, and my role is to lead the NHS Northern Gambling Service as well, which, as we'll see, is three centres: Leeds, Manchester and Sunderland, and everywhere in between. So at the moment we cover North Midlands all the way up to the Scottish borders, or we will be doing, because we're very new, we're only a week old. And of course there's an existing NHS provider in London through CNWL that some of you may know of, the National Problem Gambling Clinic, that's been around for over 10 years now. So we're part of the expansion of NHS provision across the country. So we're the first of the NHS long-term plan expansion plan for NHS provision across the country. So Anna's quite nicely talked about the way in which we're working very locally in Leeds. I'm also going to talk more broadly about our service across the north of England as well. I think just building from what Sian was saying at the beginning about prevalence, and it's very difficult to know how prevalent problem gambling actually is. I would say we don't know. There's lots of surveys and data, and they tend to say fairly similar things. But we really need much more rigorous surveys, I think, to get up to date with what we've all seen in terms of how culturally embedded gambling has become, and the mass advertising and availability, accessibility, the movement online and so on. So it'll be really interesting when we get more up-to-date quality methodology on that. There's 3 stats that strike me building on from what Sian was saying. One is that currently there are 33 million online active gambling accounts in this country. Now, of course, some people will have multiple accounts, and if the more problematic your gambling behaviour might be, you might well diversify with your gambling. So I think that would be one that I find quite striking. I think on the recent Panorama documentary, there was a stat that 78% of industry profits come from 4% of gamblers, and that was a GambleAware statistic. I haven't interrogated the veracity of that, but I find that quite staggering too. And Sian was talking about young people, and I think we should talk about children. So between the ages of 11 and 16, problem gambling rates have quadrupled over the last 2 years. So those of you who have children growing up ought to be concerned, and we ought to be thinking about how we can better raise awareness and better protect the young and the vulnerable. I'll make a couple of other quick points about addiction. It might be new to you, the gambling. It's fairly new, and as Anna was saying, it's raising its profile in the media. Addiction is addiction. So if you're familiar with alcohol or drug addictions, we're talking about the same thing. We're talking about the same hallmarks. We're talking about catastrophic consequences, as Sian was saying, to individuals, families and the community. I'd also just make reference to gambling products, which you may not be that familiar with, but I see gambling products very similar to which you might see drugs of abuse. So gambling products have different levels of what some might term addictive potential or reinforcement value built into them, which some people, it will accelerate their gambling and get them into real difficulty, and people tend to gravitate towards those kind of products. So there's lots of parallels with alcohol and drug addiction. It needs to be placed in on the same level in terms of public health that alcohol and drug addictions do. Albeit the caveat, of course, is that most people gamble recreationally. It's an entertainment pursuit. We ought not to be necessarily anti-gambling. It's just raising awareness about the other side of the coin, which is absolutely catastrophic and devastating. So a little bit of an intro, so yes, this is a mental health conference, so we should talk a little bit about mental health. This isn't a great slide, but it gives me a segue into talking about mental health. As with alcohol and drug addictions, distress and mental health go hand in hand with gambling addiction as well. A number of people can have pre-existing vulnerabilities and difficulties, but where that's not necessarily the case, gambling addiction will cause an immense amount of distress and what look very much like mental health problems. This is from a systematic research paper from a few years ago looking at population surveys. It gives you a bit of an idea of the comorbid rates. Obviously, smoking and substance abuse is highly prevalent. And I don't know what you notice as you look down the list there, but you start to think, okay, well, what's that about? And just as with alcohol and drug addiction, it's really interesting to ask the question, what do you get from your gambling? How does it help? Just as we would with somebody with an alcohol or a drug problem. That's probably my favourite question as a psychologist. And it's really informative. So gambling products will perform a particular function and a role for people. That might be an anxiolytic, it might be a dissociative effect that people are looking for. It might provide great stimulation and a buzz, and just as we think about with drugs of abuse, we talk about alcohol with drowning your sorrows. You can drown your sorrows in front of a gambling machine all day, and many people do that. So as we look through here, you see a number of mood-related difficulties and how gambling can be highly effective at escaping, alleviating mood-related difficulties. Impulse control problems are on that list as well. And of course, if the frontal regions of the brain are not working well, you've got trait impulsivity difficulties, you can see how gambling could, for some, get a little bit out of control. There are some that are not on there. From my experience, I'd put PTSD on there and trauma. I would put, I'm not a great fan of labels, psychologists tend not to be, but just for the sake of the audience, borderline personality disorder, so again an impulse control related disorder with high levels of emotional vulnerability and reactivity. But in general terms, just think about it in terms of it being very good at helping you get away from life, helping you to, perhaps if you're socially dislocated in some way, you'll find an environment here that in some way might be helpful and might help you connect to a world, albeit a parallel world or a different world, an artificial world in some way. So yeah, as I say, it's good for reducing anxiety and stress, escaping problems, as well as for those people who are much more restless and impulsive as well. You get these kind of different subtypes of gamblers as well. If you don't have a pre-morbid difficulty, as I say, and I think Anna was alluding to this, addiction is so devastating that it really causes all kinds of difficulty. So we're here to talk a little bit about the Leeds model, as it's called, which I think Anna's already mentioned. So we're working very locally with GambleAware and improving, I suppose, looking at a continuum of harm. The citizens of Leeds have some kind of intervention offer, depending on whether you're looking for prevention and early intervention, all the way along the continuum to people who've got much more complex problems. And as Anna was saying, I don't really need to add on to that how handy it is just to work so closely together so people don't fall between the cracks like we see in other addictions. So the NHS long-term plan that was announced by the previous Prime Minister earlier this year is looking to expand NHS provision up to 14 clinics across the country. So I'm leading 3 of them in the north. There's one that's been around for a while, as I say, in London. There's a young persons and children's service starting shortly as well. And as part of the steering committee, we're looking to expand over the next 5 years into those geographical areas that currently the NHS are not providing services. So we have 3 centres. The one that Anna was mentioning in the local authority building in Leeds. So this is where we are based in Leeds. It's a nice space, as you can see. This is our Manchester service, which is based at Salford Quays, near the media centres in Manchester, just by the water there. So again, another nice location, well connected transport-wise, and close to GambleAware services as well, which will prove to be handy. And then we've got a service up in Sunderland, so covering the northeast region, Newcastle and Middlesbrough and so on. So we've placed ourselves in obviously the more densely populated parts of the north, and our centres will draw people into those spaces to be seen by our clinicians. So I'll talk a little bit about what we do. So this is where we see our some of the features of what we're going to offer. So we offer gambling addiction treatment, of course, which you would expect us to do. The comorbid conditions and complexity we're able to do within the same service. We're not a replacement for a secondary care service, but pragmatically the psychologists and therapists can get on with that, which is a real bonus. Family work and affected others intervention, as well as building in peer-led peer mentor work across the service and connecting with our service users. So yes, we've got an experts by experience group that consult with us. Because we're a regional service, we will use remote consultations, and where resources allow, we'll get out and get closer to people's home. And we'll connect with our 3 centres using technology as well as being in the same room for our regular MDT meetings. We've got a learning community where our clinicians come together to reflect on the work that we do, and we have video recorded practice so that we can reflect on the adherence to our models and our practice. And we want to build in research into our work as well on an ongoing basis. So it's just a little bit of a snapshot for the NHS Northern Service. We've got a website at the Leeds and York NHS Trust if you want more information. So in addition to the national helpline, we've got direct referrals in as well by telephone, email, or a professionals referral form is on our website through the Leeds and York NHS Trust site. We're going to have an annual recovery celebration night. The narrative that people don't get over addiction problems just doesn't hold any water. So we want to celebrate recovery and get families and individuals together with us to celebrate their courageous efforts. Stopping an addiction is one thing, building a new life is an entirely other enterprise. So we want to celebrate that and change the narrative. And just to end on, that's the national helpline, which is the main port of call for referrals. So I think we're able to take questions and comments that you might have, and they'll be very welcome.